Hey guys, Dr. Tyler, McClimon Chiropractic in the spinal hygiene community. We're back again today talking about how to eliminate headaches for good. Headaches, guys, are one of the most common problems, disabilities that we see today in life, in the workforce, and they're handicapping. They, create a lot of problems for people. Over 50% of people actually have a headache on a regular basis. So it's really a problem, and like I said, one of the most common problems that we see today. The issue is that the treatment, usually for those headaches, is a medication, an anti-inflammatory, but those type things, the medications, they don't really address the root cause of the problem. They just mask the symptoms. And so why chiropractic has 80 to over 90% success rates, according to many studies, in relieving and eliminating headaches is because of what I'm going to tell you right now, okay? So there's many types of headaches. There's cluster headaches, there's tension headaches, there's migraine headaches, there's cervicogenic headaches, there's whiplash headaches, there's concussive headaches. So, there's many types of headaches. But really the solution to almost all of those types of headaches is what I'm going to talk about now. And that is addressing the structure, which is your spine. So follow me here, guys. So you have your spine, you have a curve in your neck. Normally you have a forward curve in your neck. That's called the arc of life. The neck's 7 times stronger with that curve in there. Sometimes today, especially with technology devices, we end up losing that curve. Okay, so one type of headache we get is called a tension headache. The pain comes up the back of the neck, into the back of the skull. It's throbbing, it's achy, and it's annoying. Okay, so with a tension headache and the postural patterns we have today with forward head posture, technology devices, computers, we often get that forward head posture and lose that cervical curve. We see it, I see it in teenagers today. And guys, this is a problem. Not only going to give them a tension headache, it's also going to give them arthritis in their spine in 10 years. And so, really important we know if our spine's healthy or sick, that's another subject. But back to headaches, guys. So when you lose that cervical curve, it puts tension in the muscles. It also puts tension in the spinal cord. So normally in the normal curve, we have proper structure, so there's proper balance of the musculature and not stress on the spinal cord and the nervous system. When you lose that cervical curve, it stretches the spinal cord, it puts more pressure at the top of the brainstem, and that part of the spine is this part of the spine that actually controls headaches. If there's pressure at the C1 nerve at the top here, according to the spinal nerve chart, that can cause headaches. It can cause migraines. Pressure at C2 nerve, the second one here, that affects your sinuses. Well, that can cause sinus headaches, okay? So you get it in here, in the frontal sinus, ethmoid sinus, maxillary sinus. It creates pressure, right? So this is the thing. You can take a medicine for sinuses. You can take a medicine for headaches. But is that going to change the structure in your spine? Is that going to get pressure off the nervous system? Is that going to restore that structure? You could eat healthy. You could take a pill. You could do therapy, do an injection. Is it going to fix the structure? No. The only thing that's going to fix that structure is specific chiropractic adjustments, corrective chiropractic adjustments to correct that structure. And guess what? When you do that, it takes away the nerve pressure, it takes away the headache, and it takes away the root cause of that headache so it doesn't come back without medications and without surgeries. We have tons of success with it, guys. In the office here, like I said, 80 to 90% of people will get better under chiropractic care. And I just had a guy this morning that said he had migraines his whole life. He hasn't had migraines since he started here. I hear that story often. We have tons of testimonials like that. So if you're suffering with headaches, migraines, tension headaches, and you've never checked your spine, I would highly recommend starting there. The paradigm of health today, guys, is backwards. We're all blessed to have a spine and nervous system that literally runs our life. Inside of our spine is that nervous system. Runs our life, every person on the planet. And it's usually the last thing we check if we ever check it. Your nervous system that runs your life shouldn't be the last thing we check. It should be the first thing we check. And if the body can't heal itself due to some limitation of time or matter, well, thank God we have alternative surgeries, therapies, and medicines to help us. But if that stuff shouldn't be first, this should be first. It's backwards. Does that make sense? And so that's what we do. I'm a chiropractor. It really helps address the root cause, help patients eliminate those problems, those headaches for good. So that's a little bit there, guys. If you haven't checked your spine, check us out. We be happy to take a look. and get you relief from your headaches. So that's it for today, guys, and we look forward to seeing you on our next video. God bless.